Welcome, medicos. Let's begin with this quote. If you believe, then the things turns out great. The things will turn out great. Keep believing, be positive, and keep up the good work. Now, this is the second episode of General Pharmacology Rapid Revision series for routes of drug administration. In this video, we'll be talking about oral route, sublingual, rectal, and an additional we'll be talking about nasal route. All the questions will be university exam based. Let's begin. Let us talk about the oral route of drug administration. It is the oldest and most commonest mode of drug administration, as we all know. What are the advantages of oral route? First, it is a safer and more convenient to use. Self-administration is possible. It does not require resistance. It is a non-invasive and often painless procedure, cheaper, and there is no requirement of sterilization. Also, it is convenient for repeated and prolonged use. In a chronic diseases, it is a route for choice because the patient has to take the drug every day, maybe multiple dosing. So most of the time we'll be using this. Disadvantages of this route are slower action and not suitable for emergency. It cannot be used in unconscious and uncooperative patient. It is unsuitable for unpalatable and irritant drugs. Incidence of nausea and vomiting will be more through this route. For example, if the drug is unpalatable, then the drugs which are destroyed by the gastric juice cannot be given by this route. Example, insulin. We cannot administer highly ionized drugs because it will not get absorbed, like streptomycin. Then it is not suitable for unabsorbable drugs, same aminoglycosides. Not suitable for drugs with high first pass metabolism. If there is high first pass metabolism, the bioavailability will decrease. And if there is markedly decrease in bioavailability, then we have to give high dose of drug. So we tend to avoid. For example, lignocaine. Then it is not suitable for patient with severe diarrhea and vomiting. Because if there is diarrhea and vomiting, the drug will not get absorbed. It will hamper its absorption. Examples of oral drug. We have NSAIDs like paracetamol, which we use for fever, headache, toothache. Antihistaminics like cetirizine for common cold and hay fever. Antibiotics like ciprofloxacin for urinary tract infection. Proton pump inhibitors like omeprazole, lansoprazole for GERD and peptic ulcer. Biguanides like metformin, which we use in obese patients with type 2 diabetes mellitus. Sublingual route. The preparation is kept under the tongue and the drug is absorbed then through the buccal mucosa membrane. So from the buccal mucous membrane, the drug will be absorbed and it will enter the systemic circulation directly. What are the advantages? So the advantages are bypasses liver and avoid first pass metabolism. So bioavailability will be more. It is more potent than oral and it is rapidly absorbed into the bloodstream. The action of drug can be terminated when desired. It can be thrown out. The reduced side effects due to low dose and high efficacy. The drugs will be given in low dose and it is high efficacious, so there will be reduced side effects. Self-administration is possible and it is non-invasive. The disadvantages of sublingual route are it is inconvenient and small doses can be given. Unpalatable and bitter drugs cannot be given. If swallowed by mistake, the drug may be inactivated by the gastric juice and only lipid soluble drugs should be given for better absorption, and it cannot be used for unconscious patient for obvious reasons. Now coming to the examples of sublingual route, this is the most frequently asked question in university exams. So we can learn by the trick Benz G. Do not forget this G because the first example you should give is this one only. Glyceryl trinitrate for acute attack of angina. Now what Benz stands for? B is for buprenorphine, which we give for opioid detoxification. E is ergotamine, we give for migraine. N is nifedipine for chronic stable angina and hypertension. Z is zolpidem for insomnia. So benz, buprenorphine, ergotamine, nifedipine, zolpidem, and GTN. Coming to the rectal route of drug administration, rectal suppositories, what are the advantages? There is little or no first pass metabolism. It can be used in unconscious patient, children, and with patient having severe nausea and vomiting. The gastric irritation is avoided and duration of action can be controlled if suitable solvent is used. This route is convenient for long-term care of geriatric and terminally ill patient. Disadvantages are incomplete and erratic absorption of the drug, irritation of the rectal mucosa. It is an inconvenient route and often embarrassing. Many medications are also unavailable as suppository form, so cannot be used. The examples of the drug by rectal route are paracetamol, used for fever, headache, myalgia, and osteoarthritis; diazepam for febrile seizure, anxiety, insomnia; ondansetron for chemotherapy-induced nausea and vomiting; mesalazine for mild to moderate active ulcerative proctitis; indomethacin for gouty arthritis; and aminophylline for mild to moderate asthma. Must remember at least these four. Coming to nasal route, the advantages are it is a quick and fast acting route. It will get widely absorbed by the alveolar surface. More the surface area of absorption, there will be faster absorption. So it is widely absorbed by alveolar surface. The dose is small and hence it will reduce the systemic side effects. So that's the advantage. Self-administration is possible and amount of drug administration can be regulated. It's a non-invasive procedure and less drug degradation occurs. So there will be a less drug degradation. What are the disadvantages of this route? First, special apparatus is required. It may irritate the respiratory epithelium. It may cause cough and bronchospasm. Drug dose loss can be there due to improper use. The state of nasal cavity will be affecting the absorption of drug. Coming to the examples, remember it with this naso club. Naso, you will be remembering it by nasal route. So naso club. N is for nicotine, which we use for smoking cessation. S stands for sumatriptan, which we will be using for migraine. O is oxymetazoline. It is used as a nasal decongestant in cold, hay fever, or any allergies. Then C is calcitonin for osteoporosis. B is budesonide, which we used in allergic rhinitis. We'll get back to you soon. Keep smiling. Thank you.